Hello everyone. Mental disorders and syndromes are conditions that affect a person's thinking, feeling, behavior, and overall mental well-being. They can interfere with daily life, relationships, and the ability to function normally. These conditions may be caused by a combination of genetic, biological, environmental, and psychological factors. Understanding mental disorders and syndromes is important for early diagnosis, proper treatment, and reducing stigma. With support, therapy, medication, and lifestyle changes, many people with these conditions can lead healthy and fulfilling lives. Let us dive into the video.
Mental disorders are like invisible illnesses, often misunderstood or overlooked. They affect how we think, feel, and act, shaping our interactions with the world around us. Everyday life can feel overwhelming, as if you're carrying an invisible burden that no one else can see. Imagine feeling a heavy weight on your chest, making it hard to breathe, or a sense of dread that lingers without reason. Your thoughts might race uncontrollably, making it impossible to focus or find peace. These are just glimpses into the daily struggles faced by millions living with mental disorders, each experience unique yet deeply impactful. Depression, for instance, can drain your energy, leaving you feeling empty and disconnected from the world. It can make even the simplest tasks feel insurmountable, amplifying feelings of hopelessness. It's like being stuck in a dark tunnel with no end in sight, searching for a light that feels out of reach. Anxiety, on the other hand, can manifest as constant worry and fear, gripping you tightly even in calm moments. It creates a sense of unease, as if danger is lurking just around the corner, even when everything seems fine. It's like a persistent alarm bell ringing in your head, refusing to be silenced, no matter how hard you try. This constant state of alertness makes it difficult to relax, robbing you of moments of peace and calm. To navigate the complexities of mental health, professionals use a guidebook called the Diagnostic and Statistical Manual of Mental Disorders, or DSM. Think of it as a comprehensive map that helps mental health professionals identify and classify different mental disorders. The DSM provides a common language for doctors and therapists, ensuring everyone is on the same page when diagnosing and treating mental illnesses. It lists specific symptoms and criteria that must be met for a diagnosis, helping to avoid confusion and ensure consistency in care. This standardization is crucial for research, allowing scientists worldwide to study mental disorders effectively and develop new treatments. Sometimes you might hear the terms syndrome and disorder used interchangeably when discussing mental health. While this is common, it's important to note that these terms have distinct meanings in the medical field. Understanding these differences can help us better grasp the nuances of medical diagnoses and treatments, especially when it comes to mental health. While they share similarities, it's helpful to understand the subtle difference. A syndrome refers to a collection of symptoms that often appear together, suggesting a specific condition but not necessarily pointing to a single cause. Think of it as a cluster of clues that hint at a larger picture. These symptoms may vary in intensity and combination, making syndromes complex to diagnose and manage. Imagine a puzzle where several pieces fit together to create a recognizable pattern. However, the full picture might still be unclear, leaving room for interpretation. A disorder, on the other hand, is a more well-defined medical condition. It typically has a known cause, a predictable course, and established treatment options, making it easier to address clinically. Think of it as a completed puzzle where all the pieces come together to provide a clearer and more definitive picture of the situation. For instance, Down syndrome is a genetic disorder with identifiable physical and cognitive characteristics. It is caused by the presence of an extra chromosome 21, making its diagnosis straightforward. Irritable bowel syndrome, however, presents as a group of digestive symptoms without a single identifiable cause. This makes it a syndrome rather than a disorder, as its underlying mechanisms remain less understood. A glimpse into mental disorders. Mental health is a complex and vital aspect of our overall well-being, yet it is often misunderstood or overlooked. In this section, we aim to shed light on the spectrum of mental disorders, their impact, and the importance of understanding them. The DSM, or Diagnostic and Statistical Manual of Mental Disorders, categorizes mental disorders into different types, kind of like organizing books in a library by genre. This classification system is a cornerstone for mental health professionals, providing a structured way to identify and address various conditions. By using the DSM, professionals can better understand the nature of a condition, its symptoms, and its potential causes. This understanding is crucial for developing effective treatment plans tailored to each individual's needs. Mood disorders like depression and bipolar disorder significantly affect our emotional state. They can cause extreme shifts in mood, energy levels, and even our ability to function in daily life. These conditions often require a combination of therapy, medication, and support to manage effectively. Anxiety disorders, including generalized anxiety disorder, panic disorder, and phobias, involve excessive fear, worry, and anxiety that interfere with daily life. These feelings can be overwhelming, but with the right support and treatment, individuals can regain control and improve their quality of life. Psychotic disorders such as schizophrenia profoundly affect a person's perception of reality. They often lead to hallucinations, delusions, and significant challenges in distinguishing what is real from what is not. Early intervention and ongoing care are essential for managing these conditions. These are just a few examples of the diverse range of mental disorders, each with unique characteristics and challenges. Understanding and addressing these conditions is a collective effort, requiring compassion, awareness, and a commitment to breaking the stigma surrounding mental health. Understanding mental health is crucial for breaking down stigma and fostering empathy. Just like physical illnesses, mental disorders are not a sign of weakness or a character flaw. They result from a complex interplay of genetic, biological, environmental, and social factors. By educating ourselves and others, we can challenge misconceptions and create a more supportive and inclusive society. Remember, seeking help is a sign of strength, and recovery is possible with the right support, treatment, and self-care.
Thanks for watching the video. If you enjoyed the video, please like, share and subscribe the channel. Don't forget to click bell button to get more interesting psychology videos.